Hello, and welcome to today's RateFast Speed Seminar on Spine Specialists. I'm Dr. John Alchemy. We're going to start off today by defining what is a spine specialist. A spine specialist is a doctor who specializes in treating and performing surgeries on injuries and conditions of the spine. Spine specialists are also experts in evaluating the cause of spine pain and then going on to make a determination if interventional surgery or procedures will be of use to the patient. Spine specialists perform back surgery. What is back surgery? Back surgery is a procedure whose aim is to change the patient's anatomy with hopes to minimize or remove the patient's pain and symptoms. Depending on the condition to be corrected, the back surgery may be a minor and minimally invasive procedure, such as a microdiscectomy, to remove a part of disc tissue that may be pressing or causing pain on a nerve. This can also range all the way up to multiple levels of spine surgery with fusion and the implementation of hardware to maintain stability and support in the back. Now what we call nerd knowledge. If you're a medical provider and the patient has a spine-related injury, it might be a good idea to refer him or her to a spine specialist, particularly if the patient has failed conservative measures and is not making gains on their activities of daily living and/or their ability to return to work. Here are a couple of questions to ask if referral to a spine specialist may be appropriate. Is the patient going to be able to return to work without making their back pain worse again? Is further or additional treatment of the patient's spine going to be useful? And finally, can the patient benefit from a surgical or interventional procedure or a different type of physical therapy approach or even a different type of medication? Next, we're going to do a quick problem-solving case. We have a 37-year-old male office worker who originally injured his back while lifting paper at the copy machine. He has tried basic conservative treatment such as anti-inflammatories and physical therapy. His diagnostic testing, to include an MRI of his lumbar spine, has been normal. Physical exam reveals no focal neurologic findings. The pain is still interfering with his activities of daily living, and he now desires an increase in the level of pain management. Question: is this patient appropriate for referral to a spine specialist? The answer: yes. He has exhausted all of the treatment options at the level of the primary treating physician and is still having pain and symptoms interfering with his activities of daily living and his ability to remain successfully at work. In this situation, the spine specialist will play several key valuable roles for the case management. First, the spine specialist will take a careful history and perform a physical exam. Next, the diagnostic test to date will be reviewed, and it will be determined if additional testing is appropriate. Finally, the risks and benefits of treatment will be discussed with both the primary treating physician and the patient. All told, consultation with the spine specialist in this setting will help the primary treating physician make a determination on the patient's actual date of MMI and considerations for future care going forward if no surgical intervention is planned. This concludes our RateFast Speed Seminar on Spine Specialty Referral. Please visit our website at rate-fast.com and click on the blog to learn more.